Welcome, everyone. Thank you for joining our webinar today. I'm going to wait one more minute before I begin, so thank you for your patience. And thank you for those who are just joining us. Today's webinar is Connecting Patients to Health Research Opportunities in BC. I just want to, before I get into our webinar, I want to let everyone know that today's webinar will be recorded. I've hit the record button, so there should be a file that's available for viewing in a few days through the project website on the support unit, and I'll provide a link to that website at the end of today's presentation. Before we begin, I just want to say thank you again for taking the time to join today's webinar. We had a very high number of people who were registered for today's webinar, so I'm really excited about the interest that there is. And I just want to make sure that I am, sorry, just one second, I just want to make sure that I am recording. So, yes, okay, we're good to go. Yeah, we had 180 people sign up for this webinar, so that's really exciting to see so many people who are interested in hearing about this project. Everyone will stay muted throughout the entire webinar due to the high volume of people we are anticipating, but there will be a chance for you to question that through the chat box function, and I will at the end review the questions in the chat box and answer as much as I can. This presentation will probably take about 30-35 minutes, and there'll be lots of time for questions at the end. All right, so let's begin. And today's webinar is about the BC Health Research Connection Project, and I want to see if I can introduce myself via video. Very briefly, I just want to show the face behind the voice who's talking. It says that Pat Atherton is the host, but actually my name is Stephanie Chia, and we are borrowing the BC Support Unit's webinar license. So my name is Steph, and thank you to Pat, who is actually on the line as well, for lending us a license. Okay, and after saying hi, I'm just going to sign off the video. Okay, so the project is a support unit administration project. I'm the project manager, and Dr. Robert McMaster is the principal investigator. We are from the Vancouver Coastal Health Research Institute. But to tell you a little bit more about us, the BC Support Unit, if you're not familiar with them, they are a multi-partner organization created to support, streamline, and increase patient-oriented research throughout BC. And it's one of 10 support units established across Canada as part of the Strategy for Patient-Oriented Research, a national initiative led by the Canadian Institutes of Health Research. So Vancouver Coastal Health Research Institute is the coordinating center that is leading the development of this project, but the project is really provincial, and we are collaborating with the units, regional centers, health authorities, research institutes, and universities across BC. And for those of you who are not familiar with patient-oriented research, here's a definition taken from the support unit website. It means it's research that is done in partnership with patients, answers research questions that matter to patients, and aims to improve healthcare. So I wanted to give you a little bit of background about it. It was actually formerly called Permission to Contact. And Permission to Contact, or PTC for short, is a mechanism that was first implemented by Dr. Peter Watson, who's from the BC Cancer Agency, and also from the UBC Pathology Office of Biobank Education and Research. And it was used as part of a biobank project running out of the Vancouver Island Centre Cancer Agency. So what a PTC mechanism involves asking patients in a clinic or hospital site for their permission to be contacted for future research. Their yes or no response is captured into a database that that can then be used to help researchers recruit research participants. So in 2014, a business plan was written for Provincial Permission Contact Initiative for the strategy for patient-oriented research in BC. In 2015, PTC was selected as a project of the BC Support Unit, and the BC Support Unit was just forming at that time. And then in 2016, I joined this project, and we received funding to go ahead and start planning this project. Project initiation work began, and that included an environmental scan of current permission and contact programs that are currently running in the province, as well as conducting stakeholder consultations and interviews with subject matter experts such as privacy, ethics, and researchers as well. So based on that initial consultation work in 2016, last year, we actually changed a little bit of the line of the original business plan. And that was based on what we heard from the current activities that had evolved. And we realized it would be very difficult to something on a stakeholder level. Okay, I'm just getting, sorry, a few messages about my volume not working, my audio being a little bit poor. Let me just pause 1 second. Thank you. Can everyone hear me a little bit better right now, or is it still not the best? Sorry for this little bit technical difficulties. I'm just going to try, I think we have a poor internet connection here, so I'm going to try something else. All right, so I'm just going to move on, and hopefully it sounds a little bit better for you at this time. I did get some some feedbacks from people who said it's okay. Okay, so the reason why we evolved this original permission and contact business plan was in order to achieve a few other objectives that we had. And these were really, we wanted to create something that was accessible to patients regardless of their location or where they recruit from, or sorry, where they receive treatment. We wanted to ensure that this platform was accessible to even members of the public. And we also wanted to provide a provincial recruitment strategy for researchers. And lastly, of course, also to orient, so that's where we changed permission contact to the now BC Health Research Connection project. Okay, so why is this project even being initiated? Well, the project need comes from trying to serve two different stakeholder groups. And the first is patients and the public, trying to help them find health research opportunities. And the second is health researchers who are looking for participants or trying to find patient partners in order to conduct patient-oriented research. So I hear some audio on the call. I just would please ask if you could mute yourself if you're using the computer, and I'll just move on now. So we know here in BC that actually a majority of British Columbians are interested in participating in health research, but only 15% are actually currently aware of opportunities to do so. So that's a very large gap that we're trying to close, and that leads us to our project's goals. So our goals of the project are really, we want to raise awareness of research opportunities, provide support for the patients and the public to connect to all types of research opportunities, and help researchers find potential patient partners and research participants. And our third goal is to empower patients and the public to participate and be involved in health research. So we're going to be doing that through creating a new provincial platform in order to connect British Columbians to health research opportunities. So the provincial platform will be made up of three main components. The first is the central website. So we're going to create a new at PBC to learn and find out about health research in the province. And the second component will be a research inventory, which will be hosted on the website. So this inventory is essentially a listing of research opportunities that are currently actively looking for volunteers. And we have a very broad definition of research opportunity. We want that to include both research studies, such as clinical studies, clinical behavioral studies, as well as those patient-oriented research opportunities. And the third component is the Patient-Public Research Registry. So the research registry is really meant to capture those individuals from the patient and the public who are very interested in participating or getting involved in health research, and they want to be notified about any upcoming research opportunities that they may be eligible for. So I'm going to talk a little bit more about each of those components. The first is the website, and we did some initial scanning of several programs in the province, across the country, and around the world. We found two very trying to achieve. From the PIT+Me registry from the University of Perth, second is the Research Match website, which is a national program run in the U.S. Both of these websites have a similar design to what we're trying to build, and we're looking at both of these as models for when we go to design our project. So the second component is the research inventory. So in this research inventory, someone in BC could come to the website. They see a listing of research opportunities only for looking for volunteers, and they'll have the ability to then filter by a research category, so specific types of health research they're interested in, by their eligibility, so age or demographic requirements, and then their location as well. And they'll be able to find out what's going on in BC, and then decide if they're interested in joining or not. The registry. So as I mentioned, this is meant to capture those who want to be notified about research opportunities. So they need to create an account, and they'll be asked to provide their contact information, some demographic information, and then they'll be provided the options to select their health research interests, much like this list that we have here taken from the PIT+Me website. So these are high-level health research categories off all the ones that they're interested in hearing about. Essentially, they're creating a profile for themselves that will allow them to be matched to a research opportunity. And if you think about it, it's similar to a dating website where somebody is getting matched based on their profile. So if someone does receive a match, they will receive a notification of the research opportunity that they might be eligible for. Receive an email with the name of the research opportunity, and it'll say you've been matched to this following opportunity with the message summary of what that opportunity is. A person would then have the option to say, yes, I'm interested, or no, thanks. And if they say, yes, I'm interested, they'll receive a message that really tells them, now your contact information will be securely sent to the researcher who's conducting this opportunity, and that researcher will follow up with you on your interest. If they say no thank you, then no contact information is sent. So for the platform, I've now kind of described to you what a public or a patient would do to sign up in the registry and get notified. And I also want to share with you what we have in mind for a researcher. So this is a concept right now for how a researcher might use our platform. Prior to create an account with our form, there will be a validation that will check that the researcher is a real person, they're affiliated with a proper institution. The researcher will then be asked to upload their research opportunity to the platform, and there will be another validation step. If that's a research study that they're uploading, then they'll need to have ethics approval and have ethics approved language, but And following that validation, they can then select the cohort that they're trying to notify. So at this point, they can say, I'm interested in notifying people who selected diabetes research who are male and female above the age of 35. So those matched registry volunteers will receive email notification about that research opportunity. And then the volunteer will have the opportunity to select, yes, I'm interested, or no thanks. And if they say yes, then the contact information is released securely to the researcher. And then the researcher can contact the volunteer. So in this last step, I've just included, if needed, the researcher could then follow their institutional protocols for accessing medical records in case they need to validate or verify any other additional health data about that volunteer before enrolling them. So, of course, we're a large database software piece, and we are partnering with Population Data BC on that software design. So Population Data BC so far has come up with this early design concept of how they envision the database and data transfer working. So just to briefly tell you what we have so far in mind is that, so the public participants will be signing up for the platform registry on their computer. Their information gets transferred to a web server. But we know that web servers are not the most secure. They can be easily hacked. So what we'd like to do is transfer all the data to a secure database server encrypted on the Population Data BC server behind a firewall. Also located there will be the matching engine software component. So this software will identify people in this participant database and match them with the research opportunities database. If a match occurs, there will need to be some data transfer back to the researcher, the contact information, and that will be through some secure encrypted manner, which is still yet to be determined, but this is just our initial showing doing as much as we can to protect participants' information. Is the overview of what I'm about and how you could potentially use it. We see that there could be quite a number of benefits for the patients and the public. First is the ability to find research opportunities, and the second is we think that this online platform will allow accessibility and flexibility for people to sign up. And because it's an online platform, people can access it anywhere in BC. And because it's online, they can also sign up 24/7 anytime that they want. We know that patients who are seen at a hospital site for a doctor's visit, sometimes when they're approached about research, it's not the best time because it's a stressful situation. So given that we have this online platform, they have the ability now to go home and think about it and just sign up at a later time if they choose. So I'd like to, so we want to also provide patients and the public with the power to choose the type of research they're interested in hearing about, and then they'll also be able to receive those email notifications of matched opportunities based on their preferences and the eligibility requirements. So sorry, I just got a message about the sound still being up. I'll try to take a pause again and see if I can improve it. Sorry, and please bear with us during these technical difficulties. Okay, hi everyone. I just tried to see if there was anything I could do to improve the audio, but I'm sorry, I don't know why the audio is so poor today. I am connected via Ethernet, so hopefully the internet connection is not the reason, but sorry again, and thank you for bearing with me during this webinar. Okay, so I'm just going to continue on and power through this. The next, we'd like to just tell you about the benefits for researchers that we see, which is to recruit from a broader population across BC, including healthy volunteers, because the platform will be used or can be used by anyone in BC. Anyone can sign up. So researchers will also be able to use it to find research participants and patient partners for patient-oriented research opportunities. And they can use the platform to promote or advertise an opportunity on the research inventory. And we feel that this platform will require administrative resources than some other traditional recruiting approaches like face-to-face contact in a clinic. Okay, so the project is being developed with a project working group. We have representations from all different health authorities in the province, as well as 5 patient partners. And this working group provides guidance on how the project develops and all our activities. As I mentioned, we're partnering with Population Data BC to develop the software piece, and we will be conducting both public and researcher engagement activities. So for the public, we have a few consultation events coming up across the province, and so we have Vancouver, Surrey, Interior, and possibly more. And we'll also conduct some form of online feedback for them and user testing at a later date. And so for researchers, we have been busy conducting interviews with several health researchers from different disciplines across the province. I've interviewed about 25 or so far, and we're conducting research meetings at research departments, lunch and learns, and those types of department meetings, just to let researchers know that this project is around and for opportunity to give feedback on the project. And at some point also we'll be creating some focus groups with researchers to check in on some of our design processes. I wanted to share a little bit of what I heard from the interviews that I conducted. Most of the interviews I conducted were actually all of them were actually very positive to see that this platform was coming. So that's great to hear. And some of the things that were highlighted to me were that they find that this platform would be valuable for finding healthy volunteers. They want us to design a simple and flexible way for researchers to use it. So a simple way, so not too many hoops to jump through before they act. And flexible enough they can use some of their existing recruitment or information that they already have. We need to explore how to engage vulnerable populations, as well as youth involvement, and how can we facilitate pediatric research. And lastly, we also heard from some researchers that it might be beneficial for us to explore data linkages with other health data sets. Like as I mentioned, some need to verify or validate a person's eligibility by looking at the health data. So this is a long list because there's a lot of work in progress. This is essentially our to-do list, and we are actively pursuing all of these activities here. So we want to work with community organizations to identify exactly how we can engage specific populations such as seniors, the vulnerable populations who may not be the ones to sign up on this type of online platform themselves. We also need to work with them to find ways we can support and facilitate women's health research and the pediatric research. We're working with First Nations Health Authority to identify ways we can, as well as some existing organizations, to identify how to engage Indigenous populations. We'll be working with Ministry of Health and Pop Data BC to determine if and how to link to other health data sets, and the Office of the Information Privacy Commissioner, as well as privacy experts, to verify our processes are meeting their guidelines. We'll work with the Research Ethics Board through the BC Ethics Harmonization Initiative Committee, and we'll need to create a big marketing campaign plan for when we plan to launch this platform to the public. So finally, we'll be working through creating a sustainability plan. Right now, our support unit administration funding is enough for a 2-year time period plus some initial operations expenses, but after that funding, we'll have to determine to sustain our ongoing operations. Okay, and I just want to briefly go on that we are facing during project development. And this one is about how the Provincial Platform will connect and work with other research recruitment programs. And by that I mean, for example, permission to contact programs that we know are running in clinics around BC, some hospitals, and even some health authority-wide programs. So what I've seen from how the current BC landscape is that these programs are running very they don't talk to each other, and there's no coordination. Sometimes they don't need to. And what I'd like to prevent is this platform being just another silo on the map of BC, because that can be very confusing for a confusing message for patients and the public who are signing up for these programs. We want to minimize any duplication of efforts, not only for those patients and public, but also for researchers who may be using multiple programs to recruit their research participants and volunteers. So we're really looking at how can we identify ways to coordinate and minimize any duplication. So the good news is that we have been engaging lots of people in this platform design, and we have had a lot of positive feedback from groups saying that they are interested in coordinating and identifying ways that we can streamline any processes. So here are the groups that we have represented on our working groups, and hopefully we'll be engaging more organizations as we continue planning. But it is a long process, and the scope of this project is very large, so the more people we can get on board, I think the more successful we'll be. This is a very high-level overview of our project timeline. So we started project work late 2016. We are currently in our planning and stakeholder engagement phase. Next will be design and development, and then launching in 2018. These are the upcoming activities, just to show you a little bit of what's being planned. From now until August, continue the public and stakeholder engagement. The feedback received from these engagement activities will be then influence the creation of the statement of work. That statement of work will then be used to put out a request for proposals for a website vendor. And then hopefully by fall of this year, we'll begin the website design, software, and prototype development, followed by user testing and any final development, and then summer to fall next year, do some education and training and a public promotion launch and rollout across the province. So I want to also let you know about two of the public events that are coming up. The first one is Tuesday, June 27th in the evening, located in Vancouver, and they're called the Community Dialogue on Health Research. And the second one is July 19th, and it'll be at the Surrey City Centre Library. For this Surrey event, we are hoping to have interpreters available in Punjabi, Mandarin, and Cantonese. So I just invite you to share these links with anybody you might know who could be interested in participating in health research and who wants to give feedback on this project as a patient or member of the public. So I'm coming to the end of my presentation. I'd just like to acknowledge all our working group members who are shown in this photo with a few people missing, but this photo was taken at our kickoff meeting in February. Acknowledge Dr. McMaster, the principal investigator, Stefania Manusha, who's the director of clinical trials admin at BCHRI and also a project leader, and Vivian Sum, our brand and communications leader. So here is my contact information, and please feel free to email me any comments or feedback you'd like to give me about the project. We're happy to hear it. And please also, you can visit the website located here where I post project updates and where I believe the link to today's video will also be, so you can view this video again or share it with any colleagues. Also like to thank Support Unit and the Strategy for Patient-Oriented Research. So that's the end of our presentation, but I'm going to be opening a poll for you. So the poll is for me to find out who was on the call today and what are your thoughts, some initial thoughts on what you heard about the platform. The poll will close in about 2 minutes, so Thank you for just taking a few minutes to fill that out. And as you're doing that, I'm going to be scanning the chat box now for the questions, which I will try to answer. And hopefully the chat box was actually filled with some comments about audio, so I'm hoping I'll be able to find the questions. So if you had posted a question maybe earlier during my presentation, you could maybe repost it again so that I can see it right now. Mm-hmm. Okay, so I have a question from Carolyn. Is there an intent for this platform to also provide the public with a sense of the scope of health research in BC? That is, are research projects posted for longer than necessary for recruiting participants? So I feel like that question means, are we creating an inventory of all health research that's being conducted in BC, not only those opportunities that are looking for participants? So right now, our scope is limited. We're focusing on those people who are trying to recruit or actively search for volunteers. We know that there's a lot of other inventories like that actually currently being built or are already built, such as VCHRI, Vancouver Coastal Health Research Institute, does have one similar to what you're describing. And I think there's some being built in or already built for BC Cancer. So I think that would overlap a lot with what is going on already. And so not at this time to answer that question. Okay, I have another question about the types of research opportunities that could be posted on our inventory. And it's about whether the opportunity needs to be rigorous research or could it be used to access the public for focus groups, et cetera, for quality improvement projects. So right now the focus is on research opportunities. So quality improvement, there's a fine line, I guess, on whether that's research or not, but we are offering patient-oriented research opportunities, and that those opportunities are in some ways can be creating focus groups to talk about a research project, or study design teams looking for a patient member to join their team in order to identify research questions or set research priorities for a research team. So there is a large scope of the types of opportunities you can post to the inventory. So I have another question that asks, will there be a fee for researchers to use this? And thank you for that question, because at this time we haven't really gotten to that details, but what we'd like to see is that this platform is accessible as possible and has as little barriers as possible for researchers to use it. So I don't want to say no and I don't want to say yes, but of course we'd love to offer it for free for academic researchers to use. And at the same time, I mentioned we are working on a sustainability plan, so we'll have to really look into how we'll sustain our ongoing operations. Okay. So I have a question about, it would be great to have a place on the website to highlight the results of research that have been facilitated by this initiative. You show the public what kind of work they're helping to facilitate. And that's a great comment and something that we would also like to ensure that we're communicating with patients and the public who have signed up as registry participants, and then who may have later been enrolled in a study or participated in a patient-oriented opportunity. We know it's very important to maintain that relationship with registry participants. So any way that we can help give feedback or communicate to those people who sign up for the registry that what they have been doing has led to some success, or whatever results that the research did, I think that's very important and something that we'll be looking into. I also see a recommendation to involve the public in co-designing this project as members of the project team and not just consultation focus groups. And thank you for that comment. And we are actually involving the patients on our project team. So the project working group actually has 5 patient volunteers on it. But of course, those 5 patients, they don't represent the whole of BC. So that's why we're doing more broader consultations as well through those open house community dialogue events, and then through online feedback as well. Okay, I have a really good question. Do we intend to combine this initiative with Patient Voices Network? So we have been in talks with Patient Voices Network. I think they were supposed to join the webinar today. Hopefully they were able to attend, and I'm meeting with them tomorrow. I do see that there's some overlap with what Patient Voices Network does, which is a network of patients who are volunteering for various projects. They can be like healthcare related or quality improvement related. So I do see some overlapping activities and perhaps overlapping the people who would be signing up for PVN versus those signing up on the platform. And they're one of the groups that we would like to talk to in order to identify ways we can coordinate and not duplicate efforts. Okay. The focus, so I have a question about the focus appears to be on clinical research, and will we add in social sciences focused research? Does that mean, I'm sorry if that I'm maybe confusing what social sciences research really entails, but we do have very broad, we are intending to have this support all types of research. So as long as it can be categorized, I guess, by some type of category that somebody signing up could then filter out, I think that could be doable. And I think I will just try to answer a few more questions before we sign off, and I will look at our question list after the webinar is over. But thank you again for emailing me any other additional comments you may have. So I see one question is about pediatric consent and recontact at age of majority. How will we ensure kids have parental consent to join the registry? Okay, so that's an interesting question as well that I have been asked before. Right now, we're looking at probably an age of about 15 or 16, having you needing to be that age to join and sign up in the registry. And I've been talking with the BC Children's Hospital Research Ethics Boards about what would be appropriate there. So for pediatric research, it would require a parent signing up and then selecting that they're interested in childhood research, so that they would be notified about pediatric research opportunities, and they could be selecting the categories of health research that applies to their child. So I don't think that the issue about pediatric consent and recontact at the age of majority, it doesn't apply here, because it's just really the parent who is receiving a notice about a research opportunity that they can decide to sign up their child or not. Okay, so I'll just try to find one more question that I can answer quickly before I sign off. Okay, so one question was, Once patients receive an email stating that they are eligible for a study, is the onus on them to connect with the researcher, or will the researcher have access to personally identifying data? So the process that I described with the notification, the email notification that's getting sent out to the matched participant, they have the opportunity to read about a research opportunity and then decide by clicking a button, yes, I'm interested in learning more, or no thanks, I don't want to hear about this one, does not apply to me, or I don't want to join this study. So by actively clicking yes, I'm interested in hearing more, they will receive that message that says, oh, by clicking yes, you are agreeing that your contact information will be shared with this researcher. So this specific researcher will then be able to contact you and follow up because you said you're interested in this specific opportunity. Okay, so thank you very much for everyone attending today's webinar. I hope you were able to hear me properly and really understand what the project is about. We are still doing a lot of engagement with researchers, and I hope I'll hear back from you about any comments or suggestions you may have. I'm just going to go back to my previous slide with my contact information. So here is, again, is my email and the website that you can go to find project updates. Thank you, everyone, for joining. I really appreciate you bearing with me for all the technical difficulties, and please have a great lunch. Cheers.